You said that you were not sharing vulnerable feelings and you had never really done that because you didn't think she would like that. So there's also this side of you not only feeling that she's not there for you, but you are someone that is not really lovable. Right? And that would be a critical side of you that would sort of maintain that. So not allowing you to be needy, because then you are flawed or whatever. So then it comes out with anger and criticism.
Welcome to Every Part of Us. We're two psychologists named Ruth from opposite sides of the world who are passionate about schema couples therapy.
This model provides a powerful and unique toolkit to help therapists work with complexity in couples.
Some couples have rehearsed their problems extensively, and when they come into therapy, they can be really stuck. In this fly-on-the-wall experience of schema couples therapy, we're going to see Dr. Poul Perris in action, working with a couple that have a lot of pain, but express it in different ways. They've both lost their connection with each other, one stuck in resentment and another stuck in distance. Let's observe Paul as he works with Mary, a partner that's given up, and a disconnected partner, Ruth, where there's long-term pain from constant criticism. See how Paul helps this couple get beneath their complaints and move into vulnerability, where connection can happen.
And welcome Paul onto the show. And we both know Paul professionally and as a friend, and have a lot of respect for your work, Paul. Paul's been a couple therapist in schema therapy for 20 years and contributed a lot to the schema therapy field. So welcome on, Paul.
Well, thank you, both of you. I'm really looking forward to this, and I'm glad to see you.
Well, let's maybe jump right in, if that's okay, Paul. We're going to play I'll Be Mary, and my partner Ruth we've come to therapy, and we might just get started and maybe let you guide us, and maybe a little bit out of our content and down into some of those more vulnerable emotions.
Mm-hmm.
Well, I'm glad we got to see you because, well, there's just been years of frustration, really. So I think, one of the things I find with Ruth is just, I don't know. I mean, I've had this conversation many times and, tried to really get her to sort of, I don't know, make changes, listen, So I'm glad we've got a third party because there's a few things I want to talk through today. Paul, maybe you can help her to listen to me.
Yeah, well, let me first hear, both of you, Ruth and Mary, if you started now, Ruth, saying there's a lot of, what is it that you're sensing in the relationship with Ruth?
Oh, well, we just seem to go around in circles. We have the same conversation, and I'm trying to get her to, I don't know, notice and pay attention, I guess. She just is busy with the kids and work, and yeah, I just feel like I'm not getting through.
Wow. And thank you, Mary. And for you, Ruth, what is your view on what's going on in the relationship?
Well, I just feel like she's always doubting me, just doubting. I mean, you can hear I'm just criticizing, and it just makes me question. It makes me question really what sort of relationship we got here. I mean, I worry, because this is. I don't want to feel constantly judged, to be honest, in this relationship.
So thank you both. So if I just a broader picture, if I understand you correctly, then for you, Mary, it is you sense that you're not getting through to Ruth. That's your view on it. And if I understand you, Ruth, it's like feeling constant criticized by, yeah.
And then it just makes me question, well, is it right, this relationship? Because it's not, that's not what a relationship should be, really,
Yeah. Well, there's a lot of things we could look into, but just from starting with this, and if I maybe start with you, Ruth, coming to me in therapy, what expectations do you have? What would you want to have changed in the relationship in order for you to sense that it was meaningful?
Well, I guess not to feel, I mean, well, Paul, we talked about me when I was growing up and how I could feel compared to my sister growing up, and it goes in really deep for me if I get criticized, really, really deep, and so I want to be in a relationship where I feel really accepted and loved. That's for me, that's really, really important.
Mm.
But I keep trying with Mary to explain this, but I just, it's just that, yeah, I just feel judged quite a lot. So that's not what I want. That's if that my relationship would be about feeling really.
Yeah. Could you give me a sort of a picture of when you're trying to express this to Mary? How let me see it in front of me when you're trying to express this.
I'll just say, well, Mary, maybe we shouldn't be together because this is. I don't think this is what relationships should be like. I think they should be about you accepting me. That's the.
Well, I just think
Well,
I know what you're going to say next, and I don't know if
oh,
that's
well, if we pause, thank you, Ruth, and I understand, Mary, and both of you. It can be very tough to hear each other explain and give the picture of what's going on, because we tend to have our view, and we want to have that view heard and understood. But now, Mary, how have you expressed what you want from?
Well, early on, I mean, we used to just get into yelling matches. I suppose I just couldn't. I don't know. She comes home, she's tired. I get that, but then I can't. There's no space for anybody. So I used to get really angry. I've kind of stopped that. There's not much point.
Yeah, you said earlier that you tried to get through to her.
Mm.
Yeah. Could you give me a picture of how that could look like when you're trying to get through to?
Well, Ruth, it's not new information. I mean,
well, for me, so that I can I give me an example how you might approach Ruth with wanting
well, I
to.
might say, do you want to come and sit down, or I've got a cup of tea, or like just little things. Like I don't even try to talk anymore much. I just try to, I don't know, be in the same room and have her not on a phone the whole time.
And I know, Ruth, that you might have another view on this, but I want to stay with you, Mary. As you describe when you say these things, come and sit here, let's have a cup of tea or something. How do you sense that she reacts to that when you do that?
Well, I get a bit of a grunt, or in a minute, just she brushes me off.
Yeah. And how does that make you feel?
Well, I mean, I don't know. I think anybody would be annoyed by that. It's, I mean, what kind of marriage are you going to have if you never even sit in the same room or, talk to each other? Like, it's.
Yeah, well, Mary, and I want to stay with you, Mary, for a while, and I'll get back to you soon, Ruth, and then I will explore some with you as well. But if we start with you, Mary, I can fully understand that feeling dismissed when trying to reach out, that is a painful
Yeah.
feeling.
Yeah.
You
I mean,
said, yeah, and you said it made you feel annoyed.
yeah.
Yeah, could you, how do you know that it's annoyed you you're getting? How, do you sense it in your body in a way, or how do you know it's annoyed?
Well, yeah, I just feel all turned up and like a knot kind of inside of me. She's the only person who ever makes me feel like that.
Yeah. And that knot inside of you, where is it in your body?
Well, it's right in my gut and my chest. It's like kind of a rope, really just tighter and tighter all the time.
Yeah, so it's up in the chest and in the belly as well. Yeah. And now as we're talking, can you sense it right now that
Yeah. As soon as I walked in the room, I thought, oh, here we go.
yeah. And if we pause and you place your hand on your belly and your chest, and you have that sort of like a tight rope, you said, or not, that's yeah. And if you sense it in your body, what is it telling you right now?
To give up.
To give up?
There's
And
no point. She's not gonna
no
hear me.
point?
Yeah.
She's not going to hear. Yeah, that's what it's telling you. And how does it make that part of you feel, sensing that it's no hope, she's never gonna be there?
Yeah, like it's just hopeless and like I don't matter.
Like it don't matter?
Yeah.
Yeah. And what's going on within you now as you say that?
Well, it's just really painful and I don't really want to feel that. And she already knows this anyway. So
Yeah. Well, I'm glad you're sharing with me what's going on, because you have a side within you that have a lot of hopelessness, doesn't think that it will ever be seen. And what
yeah.
else? He wants to be seen. What more?
Well, I just want to matter. I want you to like notice me and I think I'm like worth something.
Yeah, yeah. Well, Mary, what you're sharing with me is something that is extremely important for all of us, because it's wanting to be heard and seen and cared for. Yeah. And this part of you, how often does Ruth get to see this?
I don't know. Well, it's been a long time.
Yeah. And just to see if I understand you correct, Mary, you said that you carry when we started talking, you said you carried a lot of frustration and you were anger and it was this. So would you say that it's correct to say that most of the time nowadays, what Ruth gets to see is the other side of this pain, the side that is more frustrated and angry?
Absolutely. I'm not I'm kind of regretting actually showing that now. I think it's better if I'm just
Well, I can see that, since you sense that it's no use and all that, but I'm very glad that you shared this, because it's so important for all of us to be taken seriously in our pain. And the pain you're feeling is the longing to have an emotional bond and connection. And that's important for all of us. Yeah. Well, let us pause here, Mary, and I will hear with Ruth. Ruth, so if I can hear some about what you're experiencing, and I know that you might have a different view on what Mary just shared, but we all carry our view on what's going on, and for me now, it's the most important is to see what's going on within each of you. So you told me that you feel constantly criticized.
Mhm.
And what does that do to you?
Oh gosh, it really, really hurts. It's sort of, I mean, it's sort of about here. I can feel this sort of, even when we're talking about it now, this sort of, yeah, sinking and clenching a bit here.
Yeah. Could you say more? Is it sort of give me how when you sense that she's coming at you, being critical for never caring or never being there and so on, and things you're doing is wrong and you don't understand, and it's all these things that you have shared. Is what do you do then?
Well, yeah, I mean, I feel really, I feel the sadness, but to be honest, I've just learned, well, then I feel, like I said, then I feel like, well, this can't be right. This can't be right, this relationship, if I feel so sad. And I do, Mary is right. I do probably just go on my phone and I try and just get away. I try and just try and just kind of think, well, it's not important. It doesn't, well, then I don't need that so much. I don't need that relationship so much. I'm fine this, yeah.
Well, if we pause, Ruth, and I want to say to you as well that the part of you that feels sad. I mean, that's a part of you that doesn't feel heard and understood. So, and equally as for Mary, that's so important for all of us in a relationship to feel connected and heard. But you also said that the criticism was something that you sort of you didn't want to sort of acknowledge anything of it. And Mary said that, if you if she said something, you would just wash it off. And
Yeah.
could you tell me more about that in these situations when you sense you're being criticized? How would you say you typically respond?
I'll just try and stay away. If I can hear her call, with that tone of voice, that tone of voice, annoyance, I just think, oh, and I know she's saying she wants me there, but it's the annoyance. And so I just try and stay away from her, probably. I'll just think of excuses, because it makes me feel unhappy.
If we pause there, because you say that if she says something critical, you
Mm,
try just to sort of avoid her and keep away.
yeah.
If there were to be any truth that, she had a hard time connecting with you, if it would be to, you know,
Mhm.
how would it be for you if there were something with you? How would that make you feel?
What if she could really see me or be,
No, well, you said that as soon as she says something,
yeah.
you just want to keep it away because you
Yes.
don't want to, because if you would stay there and don't walk away
Yeah.
or brush it off, what could come over you?
Um, well, it's the pain. It just hurts. It just really hurts because then I have to feel that sense of not being enough. But I used to feel when I was growing up that
Yeah.
it's true. I really am not enough. I have to feel like that if I
I'm
really,
not saying you're not
Yeah.
enough. I'm just saying, like,
Well,
come
well,
and
well, Mary, yeah, I will get back to you. I just want to, if okay, just explore as I did with you. I explore, and I know that you might have different views, Mary, but just to see what's going on within Ruth. Is that okay?
okay.
Yeah. So Ruth, the thing that you would start feeling if you would not just avoid, it is some other nuance than the sadness into that pain, is it?
Yeah, I mean,
Of not being enough and not being.
yeah, no, it's really, really, yeah, I mean, that really hurts. That really hurts to think I can never be the partner she seems to think I should be, and I can never be that. However hard I try, I don't want to be with that pain anymore. I don't
So
want it.
it's sort of like being flawed as a partner or as a person, or
Feeling like whatever I do, it just can't ever be.
yeah,
It can't ever be enough for her.
yeah. And when you notice that tone,
Yeah.
not on your rational side maybe, but emotionally, what does it feel like the message is towards you? How do you sense she views you when she's saying these remarks?
Yeah, you're a disappointment. You're
Like your disappointment? Yeah. Well, I want to tell you also, Ruth, that sensing that the one we have in a relationship looks at us as a disappointment, as something not good, that's a really painful feeling, because if we take it in, how could we feel if we take in that we were sort of not good? And so what is the feelings you're really working hard not to sense when you.
uh, it's a very, very, it's a very deep sadness.
Yeah, that's the sad, it's a sad part. Yeah, and I understand it, but you also said what could be tied, what feelings in your body could be tied to.
Um, it's a sinking, sort of hopeless feeling. I think that's what I get when I feel like it's coming up again with Mary coming.
Mm,
It feels like it never changes because Paul, we've been in this for years now.
yeah.
It's,
Yeah, and just to pause with both of you, I mean, it's clearly that both of you are sensing that neither of you is either heard, seen, or cared for emotionally in what you really need within.
yeah.
And it sounds like, and both of you have to correct me if you don't agree with this, but it sounds like, at least now, it might have been different earlier on in the relationship, but now you seem stuck in a dynamic where Ruth, you handle the frustrated sort of need for connection and closeness by a lot of frustration and anger, and feeling sort of it's never happening, nothing is going to change. So there's a lot of sort of all points out in a sense. And it appears that on your side, Ruth, you have you're keeping yourself protected all the time, not wanting to hear anything that might be critical, and dismissing things. So, Mary, you try to tell, and Ruth, you try to walk away, and that is a pattern where it's really, really, I'd say, impossible to meet for both of you. And I can sense the pain both of you is trying to deal with. And it's really important for us together to see if we could find ways that when we meet, try to talk, all three of us, with this more vulnerable side in the room. Because it's so important to allow these more vulnerable feelings to be heard, seen, and validated. So before continuing, I wonder, and I could start with you, Mary. Has there ever been a time in your relationship when you felt that Ruth actually was there for you? Might be long ago, but was there a time when you felt, when this side that is now so frustrated felt that she was actually sort of caring for you?
Well, I think at the beginning we definitely spent a lot of time talking and laughing, and we connected on so many things. We've got so much similarities, and I think.
And sorry for interrupting. I'm also curious, not only sort of talking, laughing, sharing things. I really mean this more, the part of you that is with all this pain. Was there a time when you felt that Ruth was able to be there for your pain and to care for you when you were feeling lonely? Or
I don't think I've shown her that.
you haven't really shown her. Nice. Yeah.
I don't think she'd like it.
Sorry?
I don't think she'd like it.
Well, if you don't think she like it, then that's the way it is for now. But I will hear with Ruth. Ruth, is there a time when you felt that Mary was there for the part that is now feeling sad and feeling looked upon as something flawed and
No, I mean, she's right. We had good times, but no, we wouldn't. We never talk like this. No.
So just to hear with both of you, since you're coming here to seek me for help, although neither of you have really ever felt that the other one has been there to this most sort of hurt and sad part. If I start with you, Mary, would you be willing to work together, the three of us, to see if, although you don't think now that Ruth would want to be close to that part, to give it a chance to see if she would?
I'd be willing to try.
Yeah. Well, okay. And for you, Ruth, would you be willing to that we together see if Mary's able to actually be there for your hurt and sad part?
Yeah. Well, yeah, that would make me feel a lot of hope.
Yeah. Yeah. Well, that's let's say that's a hopeful start, because if you are to see me, that's what I could offer, trying to help the two of you with. Because unless we have an emotional connection where we feel heard and safe, and we can be open with our needs and feelings, unless we have that, our relationships are cold. They're cold or they're hot with a lot of painful emotions, but there won't be any, what word should I use? There won't be any true love in the relationship, a love where we respect each other, but also care deeply for each other's needs and feelings. Yeah.
Well, we might call time there, Paul. You've given Mary and Ruth a little bit of hope.
Good.
And maybe what we could do now is share. You might want to share a little bit about what was happening behind the scenes for you as you met Mary and Ruth.
Well, apart from in the first sort of 4 or 5 minutes trying to see where were we, had we met before, or was it the first? Yeah, but I was trying to see various things. Trying to see with you, Mary, I noticed, I mean, you shared that it was a lot of frustration and you had given up. And it's very common and typical in a relationship that one person might sense that he or she is the one trying all the time. And it's common that they say, well, now you didn't say that to Ruth, but you don't have any feelings and you don't, and the one being very emotional, portray him or herself as the one knowing emotions and knowing the emotional language and so on. But often it's more either frustrations they're talking about, and it comes out as criticism. It's never inviting the partner actually to meet the need. Now, you did say in a section, Mary Ruth, you said that I did try saying, come sit with me and so on. But commonly when there is this pattern over a long time, Ruth in the role play, it's common that he or she wouldn't give the partner the benefit of the doubt because they're so used that the anger is so close that it's better to say no or later, because they know as soon as I start to come, I will be criticized for not understanding or not listening. So they dismiss it. So that's a typical thing. And then with you, Ruth, in the role play, Ruth, I wanted to explore, you have the deprivation and the sadness and so on, but you were also constantly criticized, and you were coping by sort of dismissing and detaching. So I wanted to explore sort of if there was the defectiveness sort of schema tied to the deprivation. And I would have spent some more time to explore that in order to really see what are the unconditional schemas that is lying underneath your coping pattern. And also to explore more with Mary. I mean, there was it was the sort of deprivated child, but surfacing as a somewhat angry child. Not here, but I heard that that's what's going on a lot. And I also wanted to know more about what sort of internalized sort of parent modes each of you have, because you had a lot of, Mary, you had a lot of sort of demands on yourself in order to be, demands on her to be there for you. So I would reckon that you have a lot of demands on yourself, and that's also, and maybe it's just a hypothesis at this point, but you said that you were not sharing vulnerable feelings and you had never really done that because you didn't think she would like that. So there's also this side of you not only feeling that she's not there for you, but you are someone that is not really lovable, right? And that would be a critical side of you that would sort of maintain that. So not allowing you to be needy, because then you are sort of flawed or whatever. So then it comes out with anger and criticism. Yeah. So those are some of the reflections I have. Yeah.
Yeah, so it sounds like you're really, well, and I could really feel it actually. You really slowed everything down. You're really sort of using our words to help us really feel our way into our experiences. But yes, it sounds like you're really, so you're tracking the sort of unconditional schemas and the needs inside that. And I wonder what challenges can there be for couples? Well, you know, as you're doing this work, what feels challenging, or some of the blocks that can get in the way when you're doing that sort of deeper exploration?
Well, first of all, both of you were very receptive to my questions and so on. And I know, as you all are very experienced couple therapists, that if a couple is this receptive, it's not really, if you know the model and so on, it's not that hard to access these unconditional schemas. But if the coping, like for instance, Ruth, with your more avoidant and that, if that would be something that you were more sort of a default also in the room together with me, it would be challenging for a couple therapist that is not that experienced with couples therapy. It could be a great challenge to bypass, empathically confront that side in the room, because, and the pitfall could be for a therapist to just, when doing this assessment, you know, as soon as they get some surface level symptoms like some anxiety or some frustration or anger, they sense that, well, then I know what they feel. But it's so important not to just be satisfied as a therapist knowing that there's anxiety and there's anger, because those are symptom reactions in a way. We want to know what's within the anger, what's the vulnerable feelings underneath, metaphorically underneath. And if there's anxiety, what is the anxiety about? What are the vulnerable needs that are not being met? So if there's anxiety, there's a great chance that there is a side feeling defected and flawed. And it's important to put words to that so we can talk about the side feeling perceived as flawed and defective, instead of focusing on anxiety as something else than just the vulnerable child signaling, but the frontal cortex not being able to identify what it is. So it's just this thing going on. It's really about helping the couple during the assessment, because parallel to the assessment and doing it thoroughly like this, it's such an important part of starting to develop the healthy adult of the couple. Because they when I explore with Mary, you, Ruth, will see what I do, and you will learn, and you will hear, and you will identify. And as I'm doing it with Mary, the more I'm attuned, and I'm unpacking sort of the frustration and reaching the vulnerability. It's and I have her present and emotionally aware in the moment. Then her healthy adult learns how to listen to her own feelings, not only to her anger and frustration, but also how to explore deeper. It's such an important part of the whole process, the assessment, and that it's done as much to the point as possible. And
I think
yeah.
something I really noticed in the role play, Paul, that, you know, as Mary, I'd very much come with the agenda that maybe you can make her listen to me. Maybe, you know, I want to really co-opt you as sort of the enforcer in the room. But actually, as you slowed it down, as you started to get to that much more painful place of not feeling heard, and I definitely had that sense of really starting to give a picture of what the therapy was going to be about, and being quite curious when you were exploring that with Ruth, you know, like kind of as the partner, being a little bit surprised actually at some of what she said, which I really appreciated how you then guided, you know, us towards, this is the kind of therapy we're doing. So if we work together, we actually are going to be looking at those vulnerable parts, those unmet needs, and really trying to connect on that level, which, you know, as you kind of helped us to see, we probably hadn't done before. And so that gave us, I think, a bit of a window into what is schema therapy for couples? What are we trying to do, rather than just, can Paul make my partner listen to me?
And tying into that, I could say that, at least in my view, one take home message for the one listening or so on is that really try not to be caught in the content of what they're saying, and when you explore this, because if you said, for instance, well, she always walks away, she does this and that, if I would sort of start exploring that lengthy, or if I would start to explore with Ruth lengthy on how you might be critical and what words you're saying, and which is important also, but what's really important for us when we do schema couples therapy is always keeping in mind that everything we do is a means to help partners emotionally connect. So if we start to talk about things going on at home and lengthy, we miss the opportunity when we have the clients in the room to focus on what they never managed to do at home, and that is trying to be vulnerable with each other and emotionally connect. Yeah.
Well, yeah. Well, thanks so much, Paul, and it's been wonderful to hear how you work with you know, particularly with vulnerable feelings, and to be in the role play with you. I was wondering if you just as we're closing the podcast, I just wondered if you had any thoughts about maybe therapists out there who can sometimes get a bit in their head, you know, any advice you would give to sort of help them kind of be with their vulnerability as they're helping their couples to explore theirs.
Yeah. Well, there are many ways for us as therapists. I mean, the obvious is trying to sort of really know yourself, your own schemas, and how you typically react yourself if you're triggered. Sort of what are your typical coping patterns when being triggered, identifying that is something we can do in self therapy or like that. But if you've done that and you sense that you know yourself and you are more feeling having access to a healthy adult therapist mode, it's always important every time you are about to have a new session with clients to just take a minute or so and really ask the vulnerable part within you, how do you anticipate meeting this couple today? What do you need from me today during this session? And if you actually start doing that, having an inner dialogue with your own vulnerable self, if you ask that question, it will answer. And if you're really attentive and take that part seriously, it will start to tell you more. And if you then follow through and make sure during the session to be there for your own vulnerable part as it wants you to be, it will build a very strong inner connection that will make you feel even more sort of attuned and present. But I also want to say, not only the vulnerable part of you, but also the part of you with a lot of will, the one that wants a lot of things, maybe wants to be good or wants to really change things. That part you need to ask that part also. What do you think about today's sessions? What are you eager about? Or do I have access to it? Because if I don't have access to it, it will be so difficult if I have a challenging couple not to be just either paralyzed or detaching. Because if there's a lot of very strong emotions going on, might be the couple towards each other or towards you, you need to be not only present in your vulnerability, but you need to be able to be open, direct, and assertive without falling into sort of detaching and being more hard and cold. So having a balance connection with your vulnerable self and your assertive self is very important in order to feel present and assertive and caring. Yeah.
Well, thank you, Paul. I think you've given all of us therapists some homework to do to connect in with both that vulnerability and that energy for change. We really appreciate your time today and your expertise. So thank you.
Well, thank you, both of them.